Chapter 3, Theory and Health Promotion. Theories are very important when it comes to public health. It's a way to put together ideas to help us understand why or how or what might happen next when it comes to health promotion, when it comes to trying to determine someone's behavior, and when it comes to trying to understand if a new plan is implemented in an organization. Important aspects of a theory describe the current relationships among the concepts, explains how these concepts work together to influence behavior, and uses the explanation to predict future behavior. Theoretical foundations of health promotion are constructs, models, and framework. Constructs are main concepts of a theory. They describe, explain, and predict behavior. Models present and explain relationships between those constructs, and a framework provides a way of viewing the behavior that does not explain relationships between the constructs. So when it comes to theory is all three of those put together. Conceptual models in health promotion can be used to depict a theory or several theories and to draw out or illustrate findings. They are not theories by themselves. They do not specify a common set of constructs that help us understand and predict the future behavior. But models can be used to guide the design of health promotion interventions, and they're used to explain how variables and or concepts relate to one another. The socio-ecological framework, or sometimes called the socio-ecological model, or the social ecological model, it deals with the impact of multiple levels that influence the behavior on a person. So we have people at its core, like at the center, if you think of a circle, and then you'll have factors that influence their behavior. So that could be the individual factors. It could be the personal opinions, beliefs, attitudes. It could also be genetic factors and things that they were born with. Interpersonal level factors, you would think of friends, family, peers, people that they engage with all the time, that have an influence on their behavior and their thoughts and their processes. Organizational level factors are the organizations that the person may encounter or are around the person, and that would be the values, policies, goals, and the routines of those institutions or those groups that are in their neighborhoods, or maybe the job that they work at, or just maybe the hospital that they attend to as a patient. The community level factors are those that affect populations, and you could think of that more as what are the social norms, what are people dealing with as a whole, what are people's views on things, what's abnormal, and all of these things affect someone's behavior. For individual level theories, as mentioned before, are feelings, thoughts, behaviors, attitudes, genetic information, what they're born with, and some theories that deal with individual level are the health belief model, trans-theoretical model, and the theory of reasoned action / theory of planned behavior. The health belief model. So it's usually used when we're thinking about someone's beliefs and their knowledge about a health issue and how we want to get that person to change. So it could be a person that smokes. You want to know what they already think about smoking in order to follow a set of processes to get them to change their overall behavior, which also means that you have to have changed their overall belief system. And the constructs that we're going to discuss are perceived susceptibility, perceived benefits, perceived barriers, self-efficacy, and cues to action. Constructs of the health belief model. So there's perceived susceptibility, and that is when a person is likely to have a certain idea about the disease they just contracted or some health outcome, as I mentioned before, of smoking. And that's basically, what do they already think about smoking? Do they think there's a risk? Do they think there's not a risk? Or if we want to bring COVID into the example, we could think about the perceived susceptibility. How susceptible am I to catching COVID? And then we moved on to perceived severity. So we could think of what are the consequences of contracting, COVID, or continuing to smoke. How negative are those consequences? Like, how bad will it be for my health overall? Then we have the perceived benefits. And when people think of perceived benefits, they think of the susceptibility and severity. So they want to know, like, how bad is this going to be for me? Is there any benefit to me stopping smoking? Is there any benefit to me, maybe masking? Or is there a benefit to me for not engaging with other people when you're thinking about COVID? Perceived barriers are obstacles that would prevent somebody, any barrier that prevents them from doing a certain action. So does a person have anything that will block them from smoking cessation? And that could be maybe they have a lot of anxiety or a lot of stress right now. So that could be as one perceived barrier. And when it comes to COVID, people could think that, well, they were going to miss out on events and life moments if they practice social distancing. Cues to action would be triggers or catalysts or anything that gets the person to change. So keys to action to wear a mask was for people, and also to social distance was for people to hopefully one day get back to being around each other, returning to their normal lives, seeing people in person, working in person. And then when it comes to smoking, maybe that person knows someone else who got lung cancer, or they got educated on it, or maybe they're experiencing negative breathing effects from like a fire or developing COPD. And then self-efficacy is how much the person thinks that they have the control to change this behavior. So how much does the person believe that they can actually stop smoking? How much does the person believe that they could actually mask or maintain social distancing? Maybe their job, if they work at a diner, maybe they have to interact with people. So how much control do they actually have to make this change? The trans-theoretical model is used to understand someone's behavior and how that person is going to make changes over time. There are 10 processes and changes in 5 stages. Stages of change. So the first stage is pre-contemplation stage, and that's before the person starts to contemplate changing. It's what their current beliefs are of a certain situation. So we could take smoking as an example again. Whatever their current beliefs are about smoking, this is before they actually think about change. And then the contemplation stage is where the person thinks about changing in the future. Maybe they want to quit one day, they just don't know when, and they're thinking about the pros and cons of smoking cessation and when to do that. The preparation stage is when the person wants to make the change in the near future, usually within a month, and they're doing small things to get ready for the change. So maybe thinking about how much money they could save, or maybe thinking about taking more walks, or thinking about just how they're going to try to not take smoke breaks, or maybe distract themselves in a certain way. Action is the stage where the person is doing the behavior, or they're not doing the bad behavior or undesired behavior. So either the person now is taking action to not smoke. Maintenance is when the person has taken this change into their life for at least 6 months. So the person hasn't smoked for about 6 months. And then termination, and that just depends on what the situation is, or the health behavior you're trying to implement. But everyone doesn't go through a termination stage, some do. But this is where the person doesn't really have temptations to relapse, so maybe no temptation to go back to smoking. Decisional balance and self-efficacy. So decisional balance is when person weighs the pros and cons when it comes to going to each step. So it's maybe that arrow or line between each step that you're trying to get to the next phase. And it's very important when people are considering moving from one stage to another stage. It's how many resources the person have available to them. It's how confident that they are able to make the change and they can take action. For the trans-theoretical model, there are 10 processes of change that people can go through, and they don't have to go through them in a certain order. So experiential processes is what the person is experiencing. So consciousness raising is the first one, and they're taking in new information to learn more about the problem, so they're becoming educated. Dramatic relief is an emotional reaction to the problem behavior. So like realizing maybe this certain behavior is going to make them sick, or maybe it's hurting their family, or it's costing too much money. Self-reevaluation is where the person is evaluating themselves, thinking about the behavior, thinking about the issues that's causing, if they can make a difference, who they want to be as a person. Environmental reevaluation is thinking about how this is going to impact society or other people. It might be somebody who consumes too much alcohol, so maybe not being drunk in public, maybe not causing a ruckus for the neighbors. Social liberation, that is when the person is changing social norms to promote healthy behavior. So maybe they'll no longer go to the bar every night. Maybe they won't attend the bar scene at all. Now we have moved on to the behavioral processes, and that is helping others, helping relationships, maybe being a mentor, maybe being in a role where people can trust them and depend on them. Counter conditioning involves replacement. So a person has one unhealthy behavior and they replace it with something healthy. So instead of drinking with their friends, maybe they go out to eat with their friends or go to the movies or play golf. Contingency management is a type of behavioral conditioning. So the person is now motivated through reinforcements for healthy behavior. So maybe now they're saving money, or they're deriving happiness from hanging out with their friends without drinking. Or maybe they found a new relationship that they wouldn't have been able to handle before with the consumption of the alcohol. Then there's stimulus control. So it deals with people's cues or prompts or catalysts to keep them continuing the healthy behavior, and to go against the unhealthy behavior. So what's going to keep the person out of the bar or keep them from drinking so much at home? So they have to think about that. And then self-liberation is the belief that the change is possible, that they can become this person that they want to be, this new person, or even a better person, and following through with that commitment. The theory of reasoned action. So this also deals with attitudes, beliefs, and health-related behavior, but it also takes into account social norms that the person might be surrounded by. So behavior refers to a desired action. Behavioral intention is getting to that desired action. Subjective norms is what is normal in that person's life, what is coming from the outside as a norm. The theory of planned behavior also accounts for influences that the person doesn't have control of. It thinks about what the person believes about their situation, or the job they might have, the family that they're around, the neighborhood they live in, their access to making the choices that they want to make, their access to resources. So control beliefs are facilitators in behaviors to engaging in the behavior, and perceived power is how much a person believes that those control beliefs impact their behavior. Behavior analysis. So these are behaviors that people might have or want to have. So performance deficit is a person has the knowledge for it but doesn't do it. Skill deficit is the opposite. A person wants to complete or do a behavior, but they do not have the knowledge or the ability. Interpersonal level theories describe relationships between people, and those include social cognitive theory, social support, and social influence. Social cognitive theory, it's looking at health behavior within a relationship among the person, behavior, and their environment. So for the concepts, we're going to start with reciprocal determinism, and it's basically saying that all three of these play a role in one another. So someone's behavior is due to their environment, or it could be due to themselves, like the person that they are, or their behavior. And the environment has an effect on that person and their behaviors. The person who they are has an effect on the environment, and their behavior. So all of them basically interact in a dynamic way. The environment is any factor that's outside of the self of the person. So that could be if they're in an environment, like if they're a child growing up in an environment that's surrounded by drugs, or if they're in an environment where they may not have access to a bike, so they might not exercise as much. And the situation, that is basically looking at how a person perceives the environment. So how do they view their environment? Do they realize that their family is dealing with drug behavior and has an influence on them? Do they feel like they're maybe trapped in this way of life? They have to sell drugs? Do they feel like they have a way out? Do they know where to go for resources, for help, but maybe not, get their family in trouble, quote unquote? So we just have to look at how all these things are intertwined. Observational learning is seeing others have a certain behavior and then receiving benefits from that behavior. So you can think about maybe somebody who doesn't partake in drugs, maybe an uncle outside of the family, maybe he has a steady job in a loving family. So maybe that child's thinking, well, okay, there is another way of living. Behavioral compatibility, that's having the knowledge and skill to enact the behavior. So maybe having the knowledge and having the ability, like maybe they're really good at school, so they focus on that instead of falling into drugs like their family has. Reinforcement, so those are things that come from operant conditioning and help people maintain that positive behavior. So like if a person, maybe since that child is focusing on school and they're getting awards and accolades, and maybe they even get recognition from the school, get recognition from their family, then that's going to feed that behavior to keep doing well in school. And outcome expectations is what a person thinks will happen as a result of that behavior. So maybe they're looking at their uncle, looking at all the congratulatory acts and accolades they're getting, and they realize that maybe one day, I could have my own job, my own family, and my own place without the drugs involved. Maybe I can help get my family clean. So it's what is expected of that outcome, and maybe that child's first step would be going to college. Outcome expectations, so how much does a person value that particular outcome? How much does that child value the outcome of watching their uncle live a life that he's living and maybe want a life similar to that? Self-efficacy, how much control does the person believe that they have over this? How much do they believe that they can do this behavior, continue to do well in school? Self-control is how much they are able to modify their own behavior to achieve the desired goal. So how much are they able to focus on school without falling into drugs? How much control do they have over that? The family might be offering them drugs, or might just be readily accessible. Emotional arousal management. It deals with how somebody copes with negative and positive emotions surrounding the performance of behavior. So maybe sometimes it's really hard to focus, so the kid's stressed out, and it's how do they learn how to cope with that? Or maybe, the bills aren't paid, so the kid's sad, stressed out, watching the family fight because they're on drugs. And so does that child have any positive outlets? How well can the child deal with the emotional arousal that comes from these situations? Social support. It's very important that, anybody dealing with anything, or even if they're not, has social support, and that helps with thinking about the positive roles of relationships and health outcomes. There's different types of support a person can give or receive. There's emotional support, that's showing love, compassion, and care. Appraisal support, giving honest feedback, positive critiques or helpful critiques. Informational support, giving them information of how to deal with a situation, or information about resources and education, facts, statistics. Instrumental support is offering tangible help, so that could be money for a gym membership, a ride to the doctor's office, maybe for that child in the previous situation, a ride to and from school safely, a ride from sports events if they decide to join a sport or an after-school organization just to spend more time around other people doing positive things. Social influence deals with the role of relationships and health behavior that can be positive or negative, coming from outside forces of others. So thinking about the constructs is the social proximity. So how close is one person to someone else in their network? And that could be if it's someone else in a classroom with them. Usually that means they'll become friends or interact in some way if they sit next to them, if they see them in different classes, if they work next to them. So people that you're close to usually have an effect on you, or you have an effect on them. Structural cohesion. So it's related to the number, length, and strength of paths connecting the actors in the network. So maybe their kids go to the same school, or maybe their spouses work at similar jobs, or maybe they're within a family business. Maybe they have the same or similar economic circumstances. So those things make people have more social influence than people who don't have those similarities. Equivalence is similarity in social proximity. So it's just thinking about the connection that two people share, the more equivalent they are. So the more things they have in common. Organizational level theories. So we're thinking about organizations that the individual might encounter that deals with their health behaviors. And the theories we're going to look at are the chronic care model and the diffusion of innovation theory. The chronic care model is a way to deal with people that have chronic health issues when it comes to the management of those. And it deals with health professionals helping the patient and becoming a team. So 3 spheres are important to management: the community that they're around, people, family members, what they have access to in their community, the actual healthcare system and how well it's working to deal with people with chronic conditions, and the provider organizations. The 6 essential elements of the chronic care model. We're going to start with community resources and policies. So we're thinking about what are the connections between the community and any resources and policies. So what laws are in place to help this community, the sick community that needs help, or maybe this disabled community that needs help, and what is available in their area as far as maybe a community health center or therapy, places that they can get to. The healthcare organizations includes the values of the organization, the policies, training, education for the physicians, education for the health providers, like the whole team basically dealing with somebody with a certain health issue, and how they view or treat patients. And so those really play a huge factor in how welcome a patient feels and if they're going to have continuity of care. And then also how they deal with payment policies. Like, are there other ways to pay? Like, is it on a sliding scale versus insurance? Or maybe also with insurance, is there a fee for everybody at the same price? I know some places have maybe $5, $10 regardless of insurance for physicians to help. Sort of like a charity care, just to deal with certain health issues that people need to maintain but can't due to the high prices of healthcare management. Then there's self-management support, and that is making sure the patient is educated and knows how to advocate for themselves. They know how to maintain their health at home to help with the best outcome, and then also how to reach out for help. Then there is the delivery system design, and that deals with the division of labor. It includes defining where specific medical staff are needed when it comes to certain situations. Like, there might be more people needed in the ICU. If you think about when COVID happened and the world didn't really know how to deal with it at first, so they had to just reallocate people to certain places. They utilized a lot of travel nurses to help deal with areas that didn't have enough medical staff. And then there is decision support. So having a set of clear practice guidelines for the treatment of a certain illness or disease, and then using that to help with the management of that disease. And maybe also they can tailor that to the individual patient, but they have a baseline of where to start at. And then the last one is clinical information system. And that refers to the organization of patient medical records. So how easy is it for them to access? Do they have access to telehealth? Can they contact their doctor or nurse practitioner using a website or an app? All those things make dealing with health more convenient. Diffusion of innovation. So it deals with how new ideas are spread within a system. And there are 5 characteristics: relative advantage, compatibility, complexity, triability, and observability. So relative advantage is how much the new idea or innovation is superior to what they're currently using or currently doing. And if it's something that's better, then people are more inclined to partake in it versus, if it ain't broke, don't fix it. Compatibility is the consistency between the innovation and the current process. So how much work are the people going to have to do who are part of the process to make these changes? And are these changes really that beneficial? Complexity is how difficult is it to understand or to relay these messages or to enact the new ideas or the new systems. Triability is how much a person can experiment with the new system and learn it. And then observability is how much they can see that the new changes have worked, have made things easier, smoother for patients. Community level theories include both communication and structural theories. So it seeks to change the surrounding social and physical environments. So we're going to look at information processing paradigm and social marketing when it comes to mass media messaging. Information processing paradigm, it deals with how people understand and receive messages. So the source is who is saying the message. That's very important. Is it the president saying the message or just a person on social media? The message is what the source is saying. So what are they trying to convey? The channel is how the message is delivered. Is it through television commercial? Is it through social media? And that depends on who the audience is. The receiver is who the message is for. So is it for people, 50 to 60? Is it for Gen Z? Is it for millennials? So that would depend on where you will put the message and how you will put it out. And the target is the desired behavior. So what do you want the people to do? What is the point of this message? And there are 12 output steps for behavioral adoption. There's exposure, and that's getting people in contact with the message. The attention is getting somebody's attention for the message. So what can you do to catch their attention? Liking is getting people to actually like the message, how it's conveyed. Because people like something, they're more likely to comply. Comprehension, are they able to actually understand the message? So usually things are around a 4th grade, 5th grade reading level or understanding, just to make sure everybody can understand it. Generating related cognition, so putting into place that people can take this message and implement it into their lives in a way that they understand. So those are examples on commercials, like when it comes to safety. I think of someone drunk driving, maybe showing that someone can get in trouble from drunk driving, maybe showing that someone else can get hurt, maybe showing how silly people look when they're doing silly things when they're drunk, but not in a funny way, more of like an embarrassing way. And then there's skill acquisition. So promote skill acquisition by increasing how easy it is to do something or to try a new health behavior or to implement a new task. Attitude change, and that's really important, just to getting people to accept these things, these changes, to understand these changes, to want to make changes, to basically abide by these changes. Then memory storage is getting the information put in someone's long-term memory so that they can practice this in their lives and maybe discuss it with other people. So people have to actually want to retrieve the information later, and that could be a decision, and that's usually if they like the message. Then there is behaving in accord with the decision. So usually if someone's mind frame is in a certain place, then their behavior will follow. And then consolidation. So taking all that information and just putting it into part of their lives and putting it in a way that they can understand it. Social marketing. So using the principles of commercial marketing to deal with behavior change. So if you think about commercial marketing, it's like when you're in the checkout line, they have all these little things that you might want or might need. And because you're standing there and those items are there, you tend to look at them for longer. They're small. They usually cost less. So people just start grabbing things. Little items they might have forgotten, like candy, drinks, hand sanitizer, things like that. But these include the central constructs of exchange, and that's the idea that whatever this thing is going to be in their self-interest, whether it feels good, looks good, just promoting a behavior that's going to be beneficial to the person. Audience segmentation is dividing the audience as a target into groups. So it could be by age, it could be by neighborhoods that people live in, it could be by race, it could be by language. Competition is the competition from any other company or any other health environments trying to compete. So when it came to COVID, there were some people saying that it was real, some people saying that it wasn't. There were some people that contracted COVID and they were extremely ill, and there's other people that they didn't even know, they were asymptomatic. So, but they just knew through random tests that they had. So when you think of health, when it came to masking, for some people, the messaging was confusing. So that would be competition, what the information that they're taking in. The marketing matrix has 4 P's: is product, price, place, and promotion. So basically, what are the benefits of performing this health behavior? What is the cost of this health behavior? Where is a promotion going to take place? Like, do people have access to this new health behavior or access to the health behavior that's being promoted? Do they have the resources for it? And then also, where can they go for support? And then how's the message coming to them? So all of that is really important when you're thinking about spreading awareness of a health behavior to a certain group, or, all of America. You got to think of what are the dominant groups thinking, and then also the smaller groups. Consumer orientation, so you have to think like the consumer. Think like the person that you're trying to relay the message to. So usually when it comes to certain programs, like getting people off of, certain drugs like opioids, it's nice to have somebody who's already been through that process to explain to them how to get off the process and what it's like to go through detox, and like some of these programs on TV, like intervention. And then continuous monitoring is just to make sure the product is effective, make sure this new health situation is effective. So when you think of COVID, they were telling us how many cases there were per day, how many cases were serious, and then how many deaths related to COVID. So that was just continuous monitoring to kind of have it in everyone's face. Structural model of health behavior is more so to deal with the populations that aren't always reached when you're thinking about reaching all of America. There are people that just masking wasn't going to be enough for them, usually the people with underlying conditions. Like, it would help, but they were more susceptible to COVID versus other people, and having the adverse health effects versus healthier people. So sometimes models or constructs or messaging needs to be tailored to this group, so you help the most vulnerable in a situation. And these are people that have factors that are out of their control, which could be an underlying health issue. So there are 4 structural factors: availability, physical structure, social structure, and messages. So availability is how accessible is that health behavior or the resources for that health behavior for the person or people. Physical structures are what's available in that person's neighborhood or their job that is going to be conducive to the health behavior or staying away from a certain behavior. Social structures and policies or laws or mandates that have people maybe social distancing or wearing masks on an airplane. And even if it's not for the people who are completely healthy, it's for those who are still more susceptible, because they might still have to go out and interact with people, even though they are sick or do have underlying conditions, or they might still have to work. And the messaging, just making sure that it's culturally appropriate. It's also taking into account that they have health issues that are out of their control, making sure the messaging is right for them in a format that they can understand. and just making sure that they can try and stop the negative behaviors, the adverse behaviors that could make their health worse, and also promote anything that might make their health better during a time where things are so out of control.